Now, getting the flu can leave us feeling pretty rough, but for the vulnerable among us, it can be extremely serious, sometimes even leading to death.
Every year, around 8,000 people die from flu-related illness. Now, normally pregnant women are advised not to be vaccinated, but following the swine flu pandemic, this year is different. Julie Harrison reports.
Lynn Dixon is 7 months pregnant and has just had the flu jab following advice from her doctor. During last year's pandemic, pregnant women were 4 times more likely to be admitted to hospital if they caught swine flu, and the death rate was twice as high among pregnant women than the general healthy population. So for Lynn, making sure she was vaccinated was a priority.
This year is the first time that pregnant women have been on the at risk and being offered really for the flu vaccine, so I thought it best to have it. So anything that can protect us if I didn't have it, and obviously being 7 months pregnant, I want to protect me and the baby.
There are around 800,000 people in our region who will need the flu vaccine this year, as well as pregnant women. That will include the over 65s, frontline healthcare workers, as well as vulnerable groups, for example if you have diabetes. Alan Charlton falls into that group as an insulin-controlled diabetic. He works as a volunteer here at the National Trust property Gibbside in Gateshead. That means he comes into contact with hundreds of people, so can easily pick up bugs.
If you get flu, you're going to have real problems with managing your diabetes. Flu, being a virus-like condition, affects your blood sugars, and in case of diabetes, your blood sugars can go up or down, both of which can cause a kind of coma. You're also less inclined to eat properly, and if you don't eat properly, then you can't take your insulin. So rather than get ill, it's better to stay well, and that's why I have the flu jab.
The seasonal flu vaccine, which contains the swine flu strain, is slightly different to the pandemic vaccine. It protects against 3 different flu strains, all known to cause serious illness. It's not known how the flu virus will behave this winter, so those advised to have the vaccine are being urged to make sure their lives are not put at risk. Julie Harrison reporting in Gateshead.
To reinforce the message, we're joined now by Dr. Tricia Cresswell, who's Deputy Medical Director at North East Strategic Health Authority. Tricia, good to see you. How important is it that the groups mentioned in Julie's report do receive the vaccine?
It's really important because, as was said earlier, these groups of people who have chronic illnesses and including this year pregnant women, people